Hi, I'm Katherine Mangiardi, CEO and founder of Women's Health and Wealth. Each episode will interview fierce females of today, from visionary thinkers, healers, creatives, entrepreneurs, CEOs, and badass moms that are changing the status quo by living up to their full potential, all in hopes to inspire you. Along the way, we'll have many laughs about being a wife, a mother, with candid conversations and hilarious co-hosts. As women, we are all more alike than we are different, and that is a fact. Welcome to Fierce Female Podcast. I'm here with Shikha Jain, an oncologist, assistant professor at Rush University, and she's been studying oncology, and she's just an amazing woman. But not only is she a physician and loves to treat cancer, she also is really passionate about women in leadership and works with Rush and patients there, but also as a businesswoman. So we're so excited to have you, and I'm so excited to have this talk with gender equity talk with you because it's so important today, especially with our society. You know, it's an exciting time to be a woman. We have more women doctors. We have more women graduating from college and getting going on to grad school. Mm-hmm. Even our U.S. Senate. We have 25 women as U.S. Senate, 127 in Congress. So I feel like there's like this awesome women's movement, women's empowerment movement going on. So I feel like it's a really great time to be a female. But at the same time, I do think that there are things that are holding us back with women in leadership. Mm-hmm. And so I would love to get your perspective on all of that and what you really feel.
Sure. So I agree. It is a very exciting time to be a woman. There's a lot of opportunities that are out there. There's a lot more mentorship and sponsorship going on. We're seeing a lot more of people realizing that gender equity is a real issue and achieving gender parity or equality is something that we need to strive for. Mm-hmm. It's not a question of if it's going to happen. It's now become a question as to when it's going to happen. And some people just say it's the right thing to do if two people are equivalent and have the exact same skill set and are both appropriate candidates for a certain position. It doesn't make sense to pick one just because of their gender. Right. I think now that these discussions are happening more, there's more conferences out there, there's more podcasts out there, there's research coming out about it. So I think that there's a lot of changes that are going to be coming down the pipeline in the next 10 to 20 years, and changes that have already started. Wow. Something you said is very true. Women often don't reach for the opportunities, and you and I were talking about this before we even started the podcast, about how women don't reach for opportunities because oftentimes they feel that they don't check all the boxes, or they say, I'm kind of qualified, but I'm not completely qualified for this position. Right. And so studies have actually found that when they do surveys of men and women oftentimes say, well, I didn't go for this promotion because I didn't think that I was the right fit because I hadn't done X, Y, and Z. I'd done A, B, C. And half of the candidates that came were the exact same qualifications, but they had the confidence, or they had someone tell them, you should apply for this position. And so that is a real problem we face, where one, women themselves don't feel confident enough in many situations to go for those positions. Right. Two, women often don't see people like them in those positions, so they don't think that they are somebody who would be a candidate for that because the people who've come before them haven't been the same as them. And then the third thing is there hasn't been as much sponsorship and mentorship, because a lot of times people bring up people who look like them, and they do it because we all have this baseline level of implicit bias where we tend to reach out to people who we feel comfortable with. And it happens across the board. Men do it, women do it, people of different ethnicities do it. It's just you reach out to what you're most comfortable with. Right. So it takes some internal really looking inside yourself and saying, okay, have I picked a diverse group of people to be my advisors? Have I picked a diverse group of people to lead? Am I looking outside of my comfort zone? I sat down with a CEO the other day, actually, and he gave me some phenomenal advice. He said that he had put together a search committee for this leadership position in his institution, and they kept getting the same candidates over and over and over again. Wow. And he couldn't figure out why. And he said he sat down and he looked through his search committee. And everyone in the search committee looked like him. They had this similar pedigree. They came from similar backgrounds. And he hadn't even realized that he had done that.
Yeah, he subconsciously did it.
Exactly.
Yeah.
And so he was intelligent enough and introspective enough to disband the entire committee, created a new committee that was made up of women, of underrepresented minorities, people who just didn't look like him, people who he wouldn't have thought of.
Wow.
They ended up hiring a woman who was an underrepresented minority who no one had thought of in the first wave of applicants because they just didn't think of somebody who was so different from them.
Wow.
But they ended up hiring this woman. She's phenomenal, and they are so appreciative that they looked outside of their comfort basis. Exactly, outside of their comfort level. So I think those are a couple of the reasons why we face some of the gender equity issues we face. And the hope is that those types of things will start to change the more we discuss them and the more we look internally to fix things.
Right. Yeah, and I think what you said was a really valid point is, we don't have that leadership or that mentorship, and you can't be what you can't see a lot of times.
Right.
So if you don't see those women in, like, oncology like you, and you're not out there, well, you think, well, maybe I can't be that way. Or I really think tell me what you think, but I think it's more of like an internal dialogue with women, like what they have. Like they say, I don't have enough education, I don't have this, I don't have that, I can't do this. And they put themselves down sometimes, and they don't show up equally. Like I feel like women, like you want to be treated equally, but you have to show up equally, right?
Right.
So, I feel like, I don't know if that's really true, but I really think that that's an internal dialogue that women have to really overcome with themselves.
Absolutely. I think that's definitely a part of it. So I was very lucky in that my parents were huge advocates for me. And so my dad is a surgeon. And the two of them told me from the day I was born, from the first words I can remember.
That you're going to be a doctor?
Well, not that I'm going to be a doctor. What they said, when it came to being a doctor, they said, if you're going to be a doctor, you need to really be sure because it's a lot of work, it's a lot of effort, and it's a lot of time.
Right.
But they always told me, they said, whatever you want to be, you can be it. Don't let someone tell you that your race or your gender is going to put you in a different category. You are just as worthy as the next person.
Yeah.
And so for me, that's been my internal dialogue my whole life.
Right.
And there have been major missteps I've made along the way, and there's been challenges, and there have been things that have made it very difficult where people have told me, no, you don't deserve this, or no, you're not the right fit for this because you're too young, you're not the right color, you're not the right gender. So people have said that to me even in this day and age.
Wow.
And the first time someone said it to me, I was shocked because I was raised to think I could do anything.
Yeah.
And so the idea that my protoplasm, just the way I looked, wasn't in line with what they were looking for when my credentials were exactly the same as other people they were looking at, to me, I was baffled, and I didn't understand how that could be the case
in today's day and age. Yeah. And I feel like women physicians, I definitely make a stereotype here, but I feel like women physicians are better sometimes because they're more nurturing and they listen better. Just like women financial advisors, I'm a minority in the financial advisor field. There's only 16% of women financial advisors. And I feel like the reason why women financial advisors do so well is because they listen and they're more nurturing.
Yeah.
And maybe that's the same outcome as women physicians and oncologists.
I think so. There was a study that came out showing that women physicians actually had better outcomes. And there's been a lot of debate on this study, but I think the good point to take out of it is exactly what you said. A lot of times women do spend longer with their patients because they spend the time listening to the stories, or they have that level of emotional intelligence that isn't always present.
Right.
And that's not to say there aren't phenomenal men physicians out there, because there are.
Right.
But I think when you're thinking about physicians in general, women tend to discuss things. They tend to have that empathy, and it's more inherent in the nature stereotypically.
Yeah.
Part of it could be because of the way women and men are raised. Part of it could be just, the way that your biology is. There's a lot of different hypotheses as to why that is.
Right.
But you would think,
or it's just that we're just totally different human beings, right?
Exactly. I mean, men and women are different. Physiologically, we are different. And I think it's really important when people say, well, men and women want to be treated exactly the same. I don't think it's that women want to be treated like men. It's that women want the same opportunities. They want the same appreciation. They want the same accolades for what they're doing.
Right.
They want the same ability to be promoted or to be in leadership positions. It may not be exactly the same as men, but at least that should be equal. There's no reason for it to not be equal when the qualifications are equal.
Right. Exactly. Absolutely. So just to touch on that, I have 2 sons, so I'm not like man-hating. I'm definitely not that.
Right.
But, they do want to be equal in pay, because the statistics is women make 82 cents for every dollar a man makes. So that's a statistic. Like, that's a fact. Right? But they want to be equal in the positions and the levels and the job opportunities. But not like necessarily saying I'm better than men. I mean, if women, because I am surrounded by men in financial planning, and if women and men can work together, and not saying that we're better than each other, but working together to get to that next level is so important too.
Right, and it's a partnership, right?
Absolutely.
I mean, so there's on social media, there's this whole initiative called the He for She initiative.
Yeah, and I think you told me about that.
I did.
Yeah, you did.
And I have a lot of he for she's in my life. So what he for she means, for those of you who don't know, is it's men who champion women. So men who realize that this isn't a competition. It's not men versus women, and it should never be viewed as such.
Right.
It's viewed as the most qualified candidates should be the ones who are getting the positions.
Right.
And the people should be groomed for leadership positions regardless of whether they're men or women.
Right.
One challenge a lot of women face when they decide to have children, or when they decide to take maternity leave, or when they decide to, start a family in whatever way it may be, there's this thought in the back of people's minds of, oh, well, she's going to have to take maternity leave. I don't know if we want to hire her because she's going to be off for this amount of time.
Oh my gosh, that's so true.
It's going to put an unnecessary burden on the rest of our group.
Right.
And so I think that it's unfortunate, because a lot of really talented women miss out on opportunities because that is the bias that they are coming into an interview with.
Oh, yeah.
And so I think that's a challenge that women face. And, like you said, men and women biologically were different.
Right.
Men cannot physically have babies. It's biologically impossible. Maybe someday that'll change, but right now it's biologically impossible.
Right.
So it's not that we need to have men and women be the same. It's not that we need to have it as a competition. It's not that one is better than the other.
Right, agreed.
It's that you need to find the benefits of the person, and then it might be that their personality is such that they are more nurturing, or it might be that their personality is such as that they're a better leader for their personality. You just have to find those really amazing things about the people you work with, and look at it outside of gender, because we don't want to miss out on having an amazing person in charge just because that bias was in our mind of, oh, well, she might take maternity leave at some point, and we don't want to jeopardize that 3 months where other people might have to take on extra work. So,
it's so true.
Yeah.
It's career interruptions is what it's, the term that we refer to it as, career interruptions. And that's a real issue. That's a real thing. But I just want to touch a little bit on like the positions and the women. I feel like women have to have more self-confidence. I feel like they don't have the self-esteem to go out and get that job, and they need to understand like having that self-confidence comes from, grinding it out and kind of just doing the work. And your internal dialogue and what you say to yourself, monitoring your thoughts is so important. If you're constantly telling yourself, oh, I can't get that position, oh, I'm not good enough for that, well, then that's going to show up in your life, right? So I think like women have to really understand like just talking themselves into it and monitoring their thoughts and really going after that promotion, because they can get it. And keeping the promises to yourself is so important, like for your self-esteem, I feel like.
So I have 2 pieces of advice that I give to women who have that internal dialogue, because it's something, imposter syndrome is something I know that's touched on in a lot of places where people feel like they don't belong or they feel like they're not good enough. So I have two big pieces of advice I tell to all of my all the mentees that I have and just my friends. We talk about it. So the first is to have an awesome list.
Ooh, I like that. An awesome list?
An awesome list. So get your awesome list.
Good.
So what an awesome list is anytime something positive happens, because we all have positive things happen in our lives.
Yeah.
As a physician, if I get like a nice note from a patient, or a nurse tells me, wow, Dr. Jane, you really handled that situation well. Or a friend sends me an email saying, oh, I read this piece you wrote, I really liked it. Yeah. Something along those lines, something that makes you feel good. When you read it, you think, oh, that gives me the warm fuzzies.
Yeah.
I put it in a file.
Oh.
And so on days where I'm doubting myself, where I say, gosh, today was a horrible day. Oh my gosh, that was not the way I wanted today to go. Or I had, I don't believe that I'm good enough for this. Or how did I end up here?
You're self-doubting. You're doing the down the rabbit hole of the self-doubt.
Exactly.
Yeah.
I pull out my awesome list and I look at an email, or I'll look at a letter, or I'll look at something to remind me that, yes, I do deserve to be where I am. And yes, I do good things sometimes. I'm not perfect. Right. I make lots of mistakes. We all do.
And we all do. And being a woman and being human, you make mistakes.
Exactly. And I have the personality where I take it very, very personally when I make a mistake, or when someone says something where they don't agree with me, or when they feel like I'm not doing something right. It bothers me because I want to do the best that I can.
Yeah, absolutely.
So I look at my awesome list. And
that is awesome. Oh my God, well. I love that.
Isn't that
awesome
great?
List. Great.
So that's the first thing. And then the second thing is to get a binder of mentors.
A binder
of mentors.
Okay.
So a lot of people don't look for mentors outside of their own little world. So like physicians, if you're in a subspecialty, a lot of times people don't look for mentors outside of their subspecialty. Mm-hmm. What I have found is some of my best mentorships comes from people who aren't in my specialty and who aren't even in medicine. So I have a binder of mentors. I have one person who I've known. He's known me since I was like 6.
Oh, so these are male and female?
Male and female.
Oh, that's good. Okay.
And it's good to have male and female because you get different perspectives.
Totally. Agreed.
So he is a mentor who I've had for many, many years. Yeah. Another is a woman who I've met in the last couple of years who is helping mentor me into my speaking engagements and helping me develop my leadership portfolio and help me become a national leader in medicine and in leadership. Wow. I have another one who mentors me on my personal life and on balancing and work-life integration
we could just go family. a whole another podcast with that one.
Exactly. So there are so many aspects of your life, professionally and personally, that you could have people who can guide you, who've been through it. There's no point in rebuilding the wheel. There's so many people who've gone through what you've gone through. So, and there's people who are willing to share that.
Yes.
And so you've got to find that binder of people who you know, I'm having a problem on this. This is the person I know I can call and they will always help me. Or I can text this person and say, hey, I have a patient question. So I have a variety of mentors. And so those two things have helped me elevate my life, made me feel better about who I am as a person.
Yes.
And
I totally agree. A million% is I just had to cut you off because it's so true.
Right? It's amazing.
Finding people that you can trust and mentors in different aspects of your life, because you're going to go through different things in your life, right?
Yeah.
And you need that. You need those people to guide you why, like you said perfectly, why reinvent the wheel when I already have, people that I could reach out to. But I feel like some women don't, women are willing to help other women,
Right.
I think at a certain level, I totally experienced this with this Women's Health and Wealth. And with this podcast, I've totally experienced it because when I'm reaching out to these women, they're all like, yeah, I would love to be on your podcast. Oh my gosh, when is it? Da, da, da. And they're amazing women out there that just want to support you and lift you up. And I feel so blessed because of this, because this all came from other women telling me, hey, you're awesome, you could do it.
It's amazing.
And that's how this whole thing came from, right? And so I feel like there there are so many amazing women out there that are willing to support you and lift you up. And if those women, the other women or other people are negative, you just got to let them go.
Exactly.
And sometimes you don't need them in your life.
Yeah.
But finding those support system, male or female, is monumentalist in your future.
Yeah.
And it can make a huge difference.
It can change your life trajectory. I mean,
Yeah.
I've been in a position in the past where I did not have that level of support within where I was working or where I was living, or I didn't have that level of support kind of in my arm's distance.
Yeah.
And so I made an active effort to start finding people who I could rely on, who I could have as mentors, because I had all these ideas, I had all this stuff I wanted to do, and I needed people to say, yes, that's a great idea, let me help you, not, I don't know if you're the right person to do that.
Yeah,
and so
absolutely. You don't need naysayers.
Right. You need people. And I mean, I always tell people I come up with a lot of ideas. Let's say I come up with 20 ideas. 10 of them are awful. 5 are okay. And 5 are pretty good.
Yeah.
I need someone to tell me those are bad ideas. Like, don't do that. Yeah. If I haven't figured it out, that's a bad idea.
Yeah.
The 5 that are good, okay, let's see if we can work on how we can make them better.
Yeah.
And the ones that are great, I want people to say, yes, that's amazing. You should do that. How can I help you? Or I don't have the time. Let me find someone else who can help you.
Yeah.
And to find those people, it is so important in your life, job satisfaction, in your home satisfaction. I mean, I am the happiest at home when I'm happiest at work. And I find that one bleeds into the other.
Yeah, they do so often. Yeah.
They really do. And so for me to have that level of support where people say, this is a great idea, how can I help you? That's where I want to be. And so you just have to, we're too old to be listening to people all the time who are saying, no, 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 no. I mean, maybe I have
totally agree.
Right?
I can't agree with you more.
Maybe I have 20 horrible ideas. And if that's the case, then fine. Tell me I have 20 horrible ideas. But maybe encourage me and say, well, these ideas aren't that great, but let's take one of these ideas and see if we can change it into something that might be great.
Yeah. So how did you actively find those people? Like you said you made a change in your life and you're like, I really love this and I need to actively find these mentors. Was it just like naturally, did it come organically, or did you like actively like seek, like one of them you said you knew since you were 6 years old. So that was probably like a really close family friend, right? But how did you find the other ones?
So honestly, I just started emailing people. No joke.
So you just started stalking people.
I did.
I need a mentor.
I'm pretty active on social media. And so what I did was I saw people who were doing things that I wanted to do.
Oh.
And I didn't email them and ask, can you mentor me? What I did was I emailed them and I said, I'm really interested in what you are doing. And I would like to either learn from you, or I would like to do something similar to what you're doing, or I would like to do what you're doing in Chicago. So I tell myself, what's the worst that can happen? People say no, or they ignore my message.
Yeah.
So that's one thing I did. I emailed a few people who I really admired.
Yeah.
And I figured if anything, if they never responded, that was fine. At least I tried.
That's a filter right in itself.
Right, exactly.
People that don't email me back are just not interested.
Exactly.
Yeah.
So that was one thing I did, where I just contacted a couple of people, and I ended up getting one phenomenal mentor in that way. And she is helping me in so many ways I can't even tell you.
That's amazing.
Another thing I did was within my own institution, I asked other people. I said, are there people who have helped you get to where you are? Or are there people who you feel might be good for me to connect with? And so I reached out to people in that way. And then the third way, it's more organic. So you just kind of meet people as you go through life, and you start to develop a relationship, and pretty soon you realize, wow, this person's kind of mentoring me or sponsoring me, or someone will suggest me for something, and I'm shocked that this person thought of my name. Yeah. But I realized that this person has become a mentor and a sponsor, where they're starting to think of me to do things. So
a mentor and a sponsor. That's kind of how this podcast, that's how kind of how you came on here.
Exactly.
It was through another physician, which introduced me to another physician that does a podcast in Indianapolis. And that's how, and then it happens where we know the same person who's a physician at Rush. Right. So it's a small world of women. It's amazing how that happens. But Yeah, that's kind of, so you have to find people that are going to support you, and find people that are going to, really lift you up.
Yeah.
And that's really what I hear from you.
It is. And I think, it's also about paying it forward. So when you get to a point, and I wrote a piece on mentorship because I'm not that far along in my career, and that I'm not in my 60s. I'm not someone that, traditionally you would think as a mentor. But what I tell people is you can have peer mentors who are at the same level as you, who just have different levels of expertise.
Yeah.
As a physician, you can mentor college students, high schoolers, medical students, residents, fellows.
Oh, yeah.
So there's a lot of different ways you can mentor. It doesn't necessarily mean you have to be very advanced in your career where you've been practicing for 40 years.
Right.
And I have peer mentors too. I have colleagues who are at the exact same level as me who have more experience in certain things.
Yeah.
And so I rely on their guidance and their mentorship. And there's some things that I know a little bit more than them, so I mentor them. And I actually recently had somebody who was much higher than me ask me to mentor them on social media because I know a little bit about social media and healthcare.
That's actually what we're going to talk about next.
And it was, I told my husband, I said, this person asked me to mentor them. My husband started laughing. He said, aren't they like 6 levels above you? What are you mentoring them on?
Yeah, but 6 levels above you in the physician world, but not on social media.
Exactly.
Absolutely. So you do, so what do? You do social media for Rush, right? Like,
so I'm the physician director of media for the Rush University Cancer Center.
Okay.
So it encompasses a lot of different things. It's the first.
What do you not do? Come on. Like, what? You're a cell therapy, hermologist, oncologist, and now you do social media. Like, I think you're like a superwoman.
Oh my gosh, no. I'm
goodness.
Totally not a superwoman. I'm very lucky to have a very good support system and a phenomenal nanny and wonderful parents.
See, support system, that is huge for women.
Big.
All women, you cannot do it all alone. You need to find your support system.
Exactly. And you have to do it without feeling guilty. So that is the biggest mom guilt or working wife guilt or just women's guilt. It's awful. And so I have learned over the years that I'm not going to be able to do everything. It's just not possible. Yeah. There's only one of me. I can't divide myself. Right. But my kids understand that. My daughter says to me, Mommy has to go to work, so she's going to miss this. But Mommy's taking care of sick people. Oh, so she understands that, there's a reason why I'm not at what I'm at.
And then doesn't it make you feel great that your daughter's growing up knowing that you're contributing to the community? Like, you're going out and you're helping other women and you're helping other people really be there for their families.
Yeah. Yeah. And it is. It's nice. I remember watching my dad do that for his patients. And to me, that was the most special thing, running into a patient at the grocery store and having them hug my dad because he saved their life. I mean, that to me was amazing. Yeah. So, But going back to your question on social media. So, so as director of media for the Rush Cancer Center, I am in charge of a variety of things. So I'm in charge of some of the media and marketing that we do through the Cancer Center in general of our oncologists, raising up the Rush University Cancer Center as national thought leaders in oncology. And then I'm also in charge of the social media presence of the Cancer Center. So I do not have time to be the head of the entire social media, kind of managing all the Twitter and Facebook and Instagram and all the different sites, because that is a full-time job. Right. So we're hiring someone for that position that will be working closely with me. But what I do on social media specifically is I am very big on Twitter and Facebook, and I'm learning Instagram. And the purpose as a physician on these social media platforms is, one, networking, because I can talk to physicians around the world. I can ask a physician about a clinical trial that they did and say, my patient is having this issue. What trial would you try next? Or what medication would you try next? Right. What happened in your trial? And sharing information kind of across the world. Wow. Which is exciting. So it's a global health community. It really that's amazing. Is. Yeah. I mean, you can, with the patient's permission, you can post a question on, hey, my patient's having this problem. Anyone had this before? And you'll get 5 or 6 people responding, which is incredible. That's so powerful. So social media with doctors and treatments, which is what you're saying, is changing the way you're treating patients because of social media. It is because oncology care changes so rapidly that it helps, because you can almost kind of fine tune what you're looking for. So for example, if I have a patient with colon cancer who has gotten 5 different types of treatment and none of them have worked, I can reach out to my social media community and say, hey, I have this patient, and they might say, I've tried this and this works, or have you checked for this mutation, or did you see this study that came out recently? There's so much information out there. It's nice to have experts around the world who can chime in when you have a question. So that's one really nice thing about social media. It is academic for me because I read the articles that people post where they say, hey, I just had this paper published on this topic in the New England Journal, and it might be something that I missed. So that is one way it's very helpful. The second way it's really helpful is you can actually engage with patients. So I treat patients who have neuroendocrine tumors, which are a bit rarer, more rare of a tumor. And there's all these different Facebook pages and resources for patients that are out there that we can communicate with patients through them. So that comes through social media. I've had patients reach out to me through social media just asking questions, and obviously when they ask medical questions about themselves, we direct them back to their physician.
Right.
But sometimes they'll ask a question about, hey, I saw this trial. Is this something that you think is a good idea? And so it's interesting how you can engage with people through social media.
Yeah, I mean, I have doctors in my family that are medical doctors, and they all are kind of stray away from social media because what they're taught in med school was, it's kind of bridging the boundaries of, care and patient care and personal, and so you, as being a female physician oncologist, is really saying like, hey, it can play a place in even you being a doctor.
It can, and actually things have changed in the last, I would say, even 5 years. So up until 5 years ago, physicians were, maybe longer, physicians were very much not on social media.
Right.
I was told the same thing. Don't go on social media. It's not a good idea. It's not safe. And I agree. There's certain things that should not be happening. You should not be communicating with your patients through social media. It's not HIPAA compliant. It's not safe. So in those situations, I don't recommend it. But the things that I think are really important, with so much fake news and false medical information that's being disseminated, anybody with a platform can say whatever they want. There's celebrities out there talking about cancer treatments that are dangerous.
Wow.
And I've had patients come to me with articles and they say, so-and-so has said that this X, Y, and Z pill is going to cure my cancer. I don't want chemotherapy. And it's devastating because I have patients who could potentially be cured from their cancer who are not listening to physicians but are listening to these non-evidence-based, non-science therapies that are basically out there to make money.
Wow.
And so there's a huge push for physicians to get more on social media to combat this false information that's out there, because there are complementary things that work for patients. I mean, I'm all about complementing your traditional care with other therapies, but it can get very dangerous when patients forego modern medical therapy
for what they're reading on just random blog posts that there's no science backed behind it.
Exactly.
Yeah, I totally agree. So what would you say about like a woman in leadership being on social media? I mean, I feel like some women don't want to put themselves out there on social media because they feel like, well, again, it goes back to the internal dialogue. It goes back to, how they're feeling and their self-respect and low self-esteem. So women, I feel like women, if you're on LinkedIn, you're on Twitter, I mean, that's a great way to put yourself out there as well.
It is, and you always have to remember, so I always say social media is seeing people through a rose-colored lens. Even personal social media, not professional, when you're looking, we'll look and see, oh, this person went on this vacation, or so-and-so is just on this beach somewhere, and my husband and I are like, oh my gosh, we're at home, we have 3 kids, there's stuff everywhere, we haven't gone anywhere in forever, and so he'll say, this stinks.
And you're like, I feel so bad about myself.
And God. And it's so easy to do that. It's so easy to do that. And then when you're talking about professionally, same thing. You see people out there, oh my gosh, this woman or this man is giving this talk. I can't believe this person I went to college with is now nationally known, and she's talking on this level about this. And then you start to feel that, why haven't I done that? Or why did she get that opportunity? opportunity and I didn't. So you have to be smart when you use social media. You have to make sure you're realizing that people are putting the best of themselves out there.
Right.
And
yes.
so don't let that deter you from putting your stuff out there.
Right.
Because, you might not have written a book. That's okay. But you wrote this really great blog article that you're very proud of.
Yeah.
You should put that out there.
Right. And you never know somebody's story.
Right.
Like, I've been in financial services for 15 years. I've been presenting for so many years. So I didn't, like, just make up this podcast. Like, it didn't just fall into my, it kind of fell into my lap. But all those years of me building up to where I am today.
Right.
Right? And just like yourself. You know, all these years of you building up to where you are today. Nobody sees the hard work that you did 15 years ago.
Exactly.
And the nights that you were like crying and you're like, I don't know if I can do it. No. And you're just like, I just self-doubt and pity and all that stuff.
Yeah.
Nobody saw that because you're not going to post that on social media, right?
Right. Exactly.
So they just see, like you said, they just see the best of you. Like, you're this amazing woman with 3 kids and, you know, all this great stuff.
Exactly.
When it's really, that's what I love about these conversations, because, you know, like the other day when I called you on the phone, you're like, hey, my 3 kids are in the back of the car. If they start screaming, just don't mind them. And I'm like, I totally get it. I've been there. I've done that. I had vomit on myself the other day. Like, what are you going to do, right?
Exactly. You make it work. I mean, so I'm planning this Women in Medicine Summit, which is this fall. Mm-hmm. And, you know,
Talk a little bit about that.
So we're planning the summit. It's myself and another physician are co-chairing it. And we brought together a steering committee of women from around the country. And we involved all of the institutions in the Chicagoland area. So we have women from each institution. And the purpose of the summit is education and empowerment.
Wow.
So it's a continuing medical education, or a CME event, which means that women physicians who come get credit for attending.
Okay, so it's like continuing education.
Exactly.
Okay.
So it's like a continuing education event. And then on top of that, we're going to send women home with skills and ways in which they can kind of change things on a local, regional, and national level.
Ooh,
whether
amazing.
It's internal to themselves, so leadership skills, managing up, dealing with difficult situations, battling imposter syndrome, those types of things, or if they're interested in getting a national presence, becoming a thought leader on the national scale, becoming someone who leads a national event or national conference, or becomes a part of a national organization. So we have half of the day dedicated to speakers and panels, and half the day dedicated to breakout sessions where we're focused on skill building.
Wow.
And
amazing.
we have some amazing speakers coming. And so people, it's funny because, you know, I'm an oncologist, and people say to me, how did you think of this idea? Why is this something you thought you should do or you could do?
Right.
And I said, well, you know, someone needed to do it. And
oh my gosh, you're like preaching to the choir right now. Because I think so many times women wait for other people to do it. They rely on others instead of just taking the bull by its horns and just going out and making it happen.
Yep.
Like, just, you know what? I have a great idea. I'm going to run with that idea.
Exactly. And, you know, the hope is that your ideas go really well, and sometimes you fail.
Right.
You do. It happens. I've failed many times leading up to now. But you have to just keep trying, because who knows? You might change the way people look at healthcare, change the way people look at women, change the way people look at finances. I mean, there's so many amazing things we can do, but those things won't happen unless you take those risks and you take that step out of your comfort zone sometimes.
Take action and be proactive.
Exactly.
Yes, that's so true.
Yeah.
So you have, like, where is it at? It's at the Drake Hotel.
It's at the Drake Hotel, September 20th and 21st.
Okay.
Registration is open.
Well, I would love to attend.
Absolutely.
But yeah, it really is amazing. And possibly you may be speaking at our next Women's Health and Wealth event coming up in September.
Absolutely.
So yeah, that's amazing. I love what you're doing and what you're about. Because you're so, like, you're like this brilliant woman, but you're just so down to earth and you're so real.
Well, thank you.
And I love the fact that, like, all these women are coming together, and these women empowerment and being proactive, and your steps, the amazing list, awesome. Definitely something to take away.
Yeah.
So what would you like women to take away from this? Like, this whole talk. I mean, we could talk for hours, seriously. But what would you like women to take away from this conversation?
Well, I think, it's really important to remember that you can lead whether you have a title or not.
Ooh.
So you can
Oh my
be,
gosh.
It's so important because there's so many different
Yeah.
ways to lead. And a lot of
Right.
times the people who are the biggest advocates for change are the ones who are entrenched in the system because they know what needs to change. And so
Right.
if you're one of those people who doesn't necessarily have a position but has an idea, just because you don't have a position or a platform, it doesn't mean that you can't be the person to make the change.
Right.
I think that's really important. And I think it's also really important for women to realize you're not necessarily going to check all of the boxes.
Yeah.
Sometimes you just have to say, this is something that I'm passionate about. I can learn as I go if I need to.
Right.
And I'm going to do this because
Right.
that's how great ideas happen. That's how great things happen.
That's how change happens. Right.
Exactly.
Right.
So I think that for anyone who's listening to this, I think it's really, really important to just be confident in yourself and know you're going to make mistakes.
Yeah.
And learn from the people around you because I'm always learning. I know
Yeah.
that everyone comes with their own level of expertise on certain topics. So you really have to see what you have to work with and use that to your advantage and make grand changes because anyone can do it. I mean, if we're here talking about this, there's so many amazing women who've done things, and some of them come from very difficult backgrounds. Some of them have had a lot of adversity in their lives.
Oh, yeah.
And
Right.
they managed to make it through, and we read about them and we think, wow, that person's so amazing. But like you said, we don't know what struggles they've been through. So
Right.
everyone has their own story. Just remember, your story might be that you're going to be the one who makes the change. So lead whether you're in a level of power or not, because we all have that possibility and that inside, and
Yeah.
you just have to be confident in who you are and be authentic.
Yeah.
Be yourself.
Be yourself. I think that's a great way to end this. Be yourself. Be yourself, ladies. And if you want to be a really great stay-at-home mom, you could be a really great stay-at-home mom if that's really what you love to do.
Yeah.
So I really, oh gosh, I love this talk. Thank you so much. Again, another Fierce Female podcast, and we'll see you guys next time. Thanks for joining. Life is full of unknowns. We've all experienced them in one way or another. Every woman has a story to tell. This is where we can come and inspire other women. So let's empower, learn, and lift each other up. See you next time.